A lot of our babies are very sick, and when they're born very premature, some of them stay with us for months, which is going to cause quite a burden to the babies and the family and even the extended families. A lot of times for the parents, they go through this grieving process of, hey, I was supposed to have a healthy baby and now I have a sick baby. And then there's the stress and burden for the family on distance from home, financial, work, other children, childcare. At Driscoll, we truly try to minimize it as much as we can, understanding that we're never going to be able to remove it, and have them be able to just focus on their babies as much as they can. So everybody at Driscoll works towards that common goal of trying to maintain a healthy child, and that involves a healthy family and healthy foundation. Driscoll is unique in the sense that instead of having 200 beds localized just in one place, we have it spread out throughout South Texas while still under the umbrella of Driscoll. Our transport team also have several bases to try and reduce our transport time and response time, because Driscoll Children's Hospital itself is not a birthing facility. So our transport team is crucial in being available even at delivery to transport our sickest baby almost immediately so that they can get the care immediately.
Being able to have a transport team take physicians closer to the patients or the patients closer to the physicians on a moment's notice. Like literally, I pick up the phone, I say, we're going to pick up baby so-and-so. Can you do it? Yes, thank you. Okay. 2 hours later, patient is right by my side and we can start working on the patient, which actually starts the moment we receive the call from the referring physician. It's okay, what's going on? How can I help you? Let's bring the baby safely. Boom. There is a large degree of collaboration with the other centers within our system. It is open, it is accessible, and we involve not only the physician component, but also the nursing component and the administrative component when necessary to ensure that the needs of the patient and ultimately the community are met. And it is a center point of our philosophy.
Program coordination is actually very important as it provides a structure of the care that we provide to our neonates here in South Texas, but across multiple departments and different areas. We do utilize different forums where our different NICUs can come together and have those discussions, talk about the latest evidence-based practice, talk about the different patient populations in the different NICUs and how we can streamline that and structure that into a guideline that will be translatable to all the different NICUs.
We have a lot of the same policies and procedures that we share, so we're having that same expectation for everybody that we're all held to. We're providing the same family-centered focused care. We're following the same practices and procedures throughout the institution so that it's consistent. Nursing care can be consistent throughout the different systems by our education system that we provide. We make sure that all of our nurses have the same education and competencies in order to be successful and streamline the care that they give.
Everybody wants to be able to provide the same messaging to the families. Having guidelines and having policies and procedures in place, that way we can all practice in similar fashion. The guidelines are up to national standards, and Driscoll makes sure to always be at that level. And so it feels really good to know that that is spreading throughout all of South Texas.
I think the Hispanic culture that has developed in South Texas, and Hispanics we are known for being very family oriented. And I feel like the nurses adopt the babies for a short period of time while they nurse them back to health with us. And that in itself gives me a sense of fulfillment and pride that is hard to match.
Our NICU shows the amount of effort and love it takes to helping take care of a tiny baby. A lot of times during rounds, it is a whole village. I feel like I'm moving a whole village, and we move the village to each baby. That's our Driscoll model. It takes a village. My future goal is to continue to push the boundaries for our standard. We hold a very high standard, and we are continuously designated by the American Academy of Pediatrics as well as the state of Texas. And we want to continue to maintain at the highest standard so that we can continue to be up to date on all our clinical practice guidelines. It's going to continue to support the innovations that we're seeing in the surgical field.